Hi, Dr. Randy Magas here. I'm here today to talk to you about headaches. And so I don't want to talk to you about headaches in fancy terms. I want to talk about headaches more in how do they affect you. And so what are you dealing with your headaches, and is there help out there beyond what you've already done? And so I'm basically just going to talk about two types of headaches. And the first headache I'm going to talk about is migraine. So a lot of people have migraines, and that's basically the headache is caused by something going on inside the head. And so for migraines, I have two basic types of people that come in, and someone will come in and say, hey, I have migraines. I'll sit down and do an interview and talk with them, find out how it's affecting their life, what's going on. And then I get to the question, well, who told you that you have migraines? And usually they'll just say, well, I just think it's a migraine because of the way it hurts. And then the second group that comes in with migraines, I'll talk to them, do an assessment. We'll talk through things. I'll say, hey, who told you that you have migraines? And they'll say, well, my medical doctor, and I'm on these medications. And so they've been definitely diagnosed with the migraine. So either of those two groups, either person with migraines, I can help. And so when we get in and do an assessment and look at the body, a lot of times, even if the headache is coming from inside, there's also a component that's coming from the upper back and the neck. And so when I work with that patient, I'll find that they have a lot of stiffness and soreness in the upper back and in the neck, and that leads into the headache and the migraine. And a lot of times they'll tell me, hey, before I get a headache, before I get my migraine, these things will stiffen up and tighten up. And then I'll work with them and we'll get that under control. And what the people with the migraines find is if they start feeling these muscle tensions coming on, they give me a call. I'll get them in right away, get them adjusted, and a lot of times that will keep the headache from developing as bad as it normally does. A lot of times it won't last as long, and they get over it a lot quicker. And sometimes we're able to just stop the headache altogether. So it's okay to work with your medical doctor and take those medications, and then also come here and get adjusted and treated. And those two things seem to work together very well and help the patient significantly. Other than migraines, the other general group of headaches that we have are tension headaches, and they generally come from the tight muscles and they come from the neck. And there's actually a nerve on the back of the head that comes from right the skull there, and it comes right up towards the front. And I'll have people come in and tell me that they swear that they have a golf ball behind their eye, and they want to tell me that it's a tumor, but like Arnold says, it's not a tumor. And we'll go back there and work with these muscles, and there's a huge amount of tension in those muscles in the back of the neck. And so I'll work those out, adjust that neck, and then that tension headache is going to go away. And so if you're dealing with headaches, realize that you don't have to. When patients come in, they tell me that their main issue is headaches. I sit down and work with them, and then we work out a treatment plan. Some people need to come in just as little as 2 to 3 times to get their headaches under control. Some people will come in for a series of 8 to 10 treatments. But along that pathway, I start teaching the patient self-care techniques so they don't have to keep coming back, so they can regulate and manage this problem on their own. Once they get to the point where they're happy with their progress and they're having few headaches, then we take them down to maybe once a week or once a month just to keep it under control. And at that point, they're released from care and they can go out and live their life and enjoy it. And then they just understand the signs that if something starts getting bad and their self-care isn't working enough, they give me a call. I always try to get someone in the same day with a headache, and as quick as I can, get that under control for them again. So you can go back to living your life. You can be with your grandkids. You can do your golf game. You're not crabby with your coworkers at work. You're not crabby with your family when you come home, and you can enjoy what you're doing and get out and live the life that you're supposed to live.